All right, go get your cell phone, go to your home phone right now because we have a great service happening today here at Fox 13. We've teamed up with the good people from IASIS Healthcare. We have a phone bank going on. I'm going to give you the number. It's toll free. You can call with your emergency care questions, anything whatsoever. The number is 844-744-3258. I'm with Dr. Christine Anderegg. Thanks so much for joining us and for being here.
Well, thanks for having me. I'm excited to be here.
Yeah, you know, when people are sick, their child's sick, and they have to go in for emergency care, it can be a scary situation, not knowing what to expect.
Yeah, it can be really hard. It's hard enough to be sick or to be injured, and then kind of intimidating and sometimes anxiety-provoking to have to go to the hospital. So to know what to expect can really help reduce your anxiety and make the process a lot smoother. So when you first walk into the emergency department to check in, you'll be greeted by a triage healthcare professional that'll assess you, take your vital signs, and help determine when you'll get seen. They do a process called triage, which helps determine the priority in which patients are seen by the emergency room physician. That's based on your symptoms, your condition, and your vital signs. And people probably know that in the emergency room, you're not seen on a first-come, first-served basis. You're seen based on how sick you are and how critical your condition is. So the really sick patients, really critical, get taken back right away, and then you might have to wait if you're not one of those patients. And so you may, if you're not needing to immediately be seen, you may be asked to go to a registration area where you'll provide your health insurance information, your contact information, and then you might need to wait in the waiting room for a little bit. So the triage person is there in the waiting room to kind of assess who needs to be seen first by the ER doc. So if while you're waiting your condition changes or you're feeling worse, let them know so they can reassess you and then maybe get you back a little bit quicker. And our goal is to get you back and taken care of and out of pain and doing better as quickly as we can. And we know that it's hard to be there and it's hard to wait. Once you're back in the emergency department, the emergency room doctor will see you, examine you, take your history, and then based on what's going on, maybe order some medical tests. And the doctor, the nurses, the techs, everyone will try and help keep you informed on your treatment plan and what's going on. And then based on how you're doing, you may or may not be admitted to the hospital.
And one thing I have noticed with the IASIS healthcare professionals is that they're so understanding and willing to answer questions. So don't feel afraid or scared to speak up if you are wondering about something.
Right. We want to take care of you. We want to know what your questions and concerns are, and we can help you best if you aren't afraid to communicate with us and tell us what's going on. And we try to help keep you in the loop, too. I've been with my family as patients in an emergency department, and you often feel like, have they forgotten me? This is taking so long. Do they know I'm here? Our goal is to really help you know we're concerned about you. We want to get you taken care of. And one of the neat features that all the IASIS hospitals in Utah has is a feature called utaher.com, where if you don't have a life-threatening emergency condition, you can actually register for a treatment time online at the utaher.com website and then wait at home rather than in the waiting room for your evaluation time. And if there's a delay, a perceived delay, then you're contacted in real time either by phone or by email to kind of let you know, we just had an influx of ambulances or critical patients, so we got to bump your time. But let you be sick at home and in your jammies instead
on the couch.
Of in public.
That's such a great service. utaher.com.
Yep.
All right, great. We'll get those questions coming again. The phone bank, they are here answering your emergency health questions. They're going to be here until 6 o'clock tonight, and they're happy to help you.